Meanwhile, the World Health Organization is urging countries to prioritize vaccinating health workers. According to its new report, 115,000 healthcare workers may have died from COVID-19 as of May. The figure comes from a broader estimate of 80,000 to 180,000 deaths. Condemning global vaccine inequality and urging G20 countries to immediately fulfill vaccine sharing commitments, the WHO's Director General continues to insist that all health staff be vaccinated. According to him, less than 10% of health workers in Africa have been fully vaccinated, while the number reaches over 80% in most high-income countries. Well, for more on this, we're joined by Professor Rodney. He is the Vice Chair of the Department of Pathology at the Aga Khan University Medical College here in Nairobi. Good evening, Professor. Thank you so much for joining us in Africa Live. Professor, more than 100,000 health workers are reported to have lost their lives in various parts of the world. What is the situation in Africa?
Well, the situation that I can respond to most directly is the one at Aga Khan University, where I'm intimately involved with the COVID infections, both patients from the outside and staff on the inside. And what I can say is that we have lost nobody, none of our staff members to COVID, and very few serious illnesses. So the situation is not all bad. And one of the things to remember is that many of the infections in healthcare workers actually came because they were infected outside the healthcare setting. So while there is a risk in the healthcare setting, it's not always as high as the numbers might suggest. And what we found at Aga Khan is that when our staff members have been infected, most often it's from the community and or their household. Very rarely has it been from patients. But we also have an aggressive testing policy if somebody thinks they might be ill. And we've had mask requirements from early on for all the healthcare workers and for patients who are able to wear them. And I think those things have dramatically decreased the risk to healthcare workers and to patients.
Professor, you've shared some of what Aga Khan has done to just keep those numbers pretty impressive from what you've said. What can African countries do to improve the well-being of healthcare workers and perhaps also learn from some of what you've learned in dealing with this crisis?
Yes, good question. And it would be wonderful if everybody had the resources that we have had for our own staff members. There was an aggressive move early in the pandemic to create a task force for COVID preparation and making sure we had plenty of all of the required PPE. And I'll just make a comment about that. What we're learning about COVID over the last more than a year is that it's really not spread by contact. It's spread through the air almost exclusively. So the approaches for preventing mean wearing masks, N95 when they're available, and for some settings, surgical masks are okay. That's another separate discussion. We didn't use any masks with the valves in them because they only protect the person wearing them, not the people around them. And something that's been neglected, I think, across the board is having good ventilation systems. And, you know, some of the public hospitals will decrease the risk just by opening windows, even if there is nothing more elaborate than that. So, and of course, the biggest thing that can be done is immunize the staff members. That's been an aggressive campaign on our part in Aga Khan, and we have a very high uptake rate for the immunization. Sometimes, yes, there was a bit of pressure for people to do it, because we want to protect our staff members and the patients. And the best way to do that is by full immunization. So really, three main sets of things. Vaccination is going to be by far the most effective. Provision of masks, the right kind for the right setting, and then really looking at the ventilation systems within the hospital.
Thank you so much for your input and for joining us here on Africa Live, Professor. Professor speaking to us about just some of what Aga Khan University Medical College has done here in Nairobi to keep those numbers of healthcare workers who've been infected by COVID-19 to a record low.